The first talk is neuroplasticity and aging brain,
Yes.
the importance of cognitive training, a topic which is not specific to menopause but very important and very less discussed. And specifically, it is related to the geriatric medicine. Uh, Still, many things are not understood as far as the neuroscience is concerned. Where neuropsychiatry ends and where neurophysician starts, that is yet to understand as Dr. Nirja, you were discussing with Dr. Dalal. So many things are not understood even today. And this talk is none other than by very senior gynecologist from Chandigarh, always sees with very innovative ideas, with big vision. Dr. Nirja Chawla, she is chairperson of Digital Education Committee of Indian Menopause Society. You talk much about the importance of digital education and the future of it. And today in COVID era, we are observing the importance of digital media. So thank you for it, Nirja. Regarding her biodata, she is gold medalist from Delhi. She has several distinctions and university first prize. Former consultant from Department of Obstetric and Gynecology, PG Institute, Chandigarh. Vice President of Foxy Northern Region, Chairperson of Digital Education Committee, I already told. Ex-President and Founder Convener of Chandigarh Obstetric and Gynec Society, and with many more credentials. But I have heard this talk by her in one of the webinar, and it is very interesting and it is very important to learn what is the importance of the cognitive function, because the brain is always able to generate new neurons, and brain has the ability to learn anything at any age. That is the main idea behind this lecture. So let us first hear what she wants to say, and after her lecture we will discuss in detail. So welcome Nirja, and explain us in detail the importance of neuroplasticity and aging brain.
So thank you and good afternoon, everybody. And our esteemed and honored chairpersons, Jignesh and Anita. And I thank Yashodhara, Deepa, Asna for inviting me to Lucknow again for a presentation. Of course, this one is a virtual presentation. And yes, this topic is very interesting to people and it has come back on popular demand. So we have always felt that the brain is rather fixed and that whatever intelligence we have does not change. This is what our belief was, that as we grow older, we cannot change. So we are here to explore today that what are the effects of aging on the brain and is it possible to reverse that? And if it is possible, then how? So that is the basis of my presentation today. And uh, everybody has, the scientists at least have demonstrated to a great extent that aging is synonymous with cognitive decline. Even the public is very well aware of it. So we all know that this actually does happen. Now, when we have asked older adults, what is your greatest fear as you grow older? So they have all answered this, that the inability to live independently is their greatest fear. So there is a cognitive decline as they age, not only due to the aging process, but also due to neuropathology. So Alzheimer's and Parkinson's. Now these dementias and all these are not the purview of my presentation today. So we are actually going to focus basically on the aging brain. So is it possible to delay and to prevent age-related cognitive decline? Is it possible that we can actually arrest or even reverse the age related cognitive decline, thereby improving it? Now, when you casually look at the media, you see a lot of pills, elixirs, brain training programs, a lot of secrets which allege that they can rewire the brain. But probably all these are too optimistic and they border on fraud. What does the science say? Is the brain fixed or is it malleable? So before we go further, for my own reasons, I needed to understand what exactly is cognition. We talk so much of cognition. I want to know what exactly is it. So I share with you that cognition is a mental process of gaining knowledge, comprehension, retrieval, and using that. So examples of cognitive skills are many, like inability to focus for long so as to be able to complete that task, inability to focus on a single task without any distractions, multitasking. It's something like having your coffee or talking on the phone and cooking at the same time. Or in elderly people driving, are they able to take care of all the crossroads and the vehicles from the crossroads and also take in this input that a pedestrian is about to cross? So, all this is multitasking. Information from the past. What was that word? What was that place? And what was that name? All these are long term memories. Working memory is same as short term memory. This is that in case you have to repair something, some program on your own computer, and you are following instructions, are you able to remember all those instructions for the duration that you need to repair that or do that? Logic and reasoning refers to problem solving, idea generation, analysis of data, compiling of reports, auditory processing, making sense of sounds. Visual processing is spatial processing.
अब हम फोन पे बात कर लेंगे.
Spatial processing, that in case you have to do a parallel park, are you able to go like this and then at the correct point turn your car wheels to go like that? That is spatial processing. And the speed of processing. What they have found is the areas which I have marked in red, at least what I found was that the aging process is associated with these mainly. Of course, cognition is not a single skill, it is a complex conglomeration of several cognitive skills. But the most important in the aging process is the decline of speed of processing. So you see here, the core cognitive abilities connected with aging are these 4 or 5 of them. And this is known as fluid intelligence. Fluid intelligence is known to decrease even in those people who have a very high intelligence subset of people. So as they age, it will decrease. But the crystallized intelligence is knowledge or vocabulary that may actually increase. So, what exactly is aging? In very simplistic words, we would say that decrease of the volume of the brain, white matter degradation, amyloid deposition, functional decline of activity. Most of the aging effects are the hippocampus is the seat of that. So, all the functions which are associated with hippocampus are actually the ones which will be involved first in the aging process. Can we change this? So, the most compelling data about this has come from patients of stroke who have had some sort of a permanent brain damage, either due to a bleed or a clot. And we have seen that they make dramatic recovery with sustained therapy. Now, another example is the London cab drivers. They have to pass a particular test which is known as the knowledge. That is the name of that test. And in that, they have to master. It takes them 3 to 4 years to do so. They have to master the 350 main avenues of London, 25,000 streets, 20,000 landmarks. And when they examined them, they were found to have a bigger hippocampus. And those people who learned all this but didn't clear that test, their hippocampus was not as big. So, yes, it is possible to change a static or a declining brain, and neuroplasticity is very much possible. So, how would you define it? So, neuroplasticity is the ability of the brain to change in structure, volume, amount, size, function, the connections, the arborizations with different synapses, and reorganize in a sustained manner in response to internal and external stimuli. It is the basis of both learning and relearning. So, definitely, the central nervous system does regenerate, it is adaptive. And neuroplasticity is a compensation for these age and disease related changes. It underlies our ability to adjust, learn, and to remember. So, the most critical periods for neuroplasticity are soon after birth and in the aging and in adulthood when there are certain special opportunities. How does it do it? It is neurogenic, synaptogenic, and depends upon membrane depolarization, axon growth, increased synaptic activity. This is a very simplistic way of looking at it, but enough to understand that this is what happens. How will you measure it? See, the most important ways to measure it is behavioral, and the working memory will improve. Other than that, volume, neural activity, on your scans, the neural tissue, the blood flow, all that improve, and you can check them out with various neuroimaging techniques as well as by the use of biomarkers like the brain dependent neurotropic factors. This particular factor, in fact, is the one responsible for the synaptic activity. So, the more of BDNF, the more of the synaptic activity. But we must, of course, remember that these are surrogate markers and they are actually just replacements. They are not the real evaluation of the end point, but they do not really capture the effect of therapy on the clinical endpoint, but they give us an idea. So now straight away, without losing any more time in forming the basis of neuroplasticity, let's look at how can we reverse the aging effects on the brain by the use of neuroplasticity. There are three cornerstones to the how. The first cornerstone of this how is physical activity. So being physically active actually decreases the risk of cognitive decline, and it improves several other cognitive functions also, as well as the structures and the volume. And this is there even in the aging, the normal but the aging brain, as well as in those with neuropathology. Midlife physical activity is much more beneficial than starting it when you're old and a doddering person, not able to even stay steady. And the protective effect is at all levels of activity because most people are a little scared. How much of physical activity do I have to do to reverse the aging process? You do anything, something, but do it regularly. Now, what exactly constitutes the which physical activity? What should you do? So I looked into the literature and found that aerobic exercises, which are also known as cardio. So these exercises are the best for improving the neuroplasticity and cognition of the brain. Aerobic exercise means that you're using oxygen to meet your energy demands. Now, if you're doing a certain exercise and by your respiration, your oxygen is able to meet the demands of that exercise, that is an aerobic exercise. But any exercise that you're doing so vigorously that your respiration is not able to provide it with enough oxygen to for its own demands, that becomes an anaerobic exercise. What they found was that the aerobic exercises are promoters of neuroplasticity, and you can sustain an aerobic exercise for long periods of time. But how much do you need? Just moderate exercise 3 times in a week. And the studies showed that there was significant improvement in the volume of the brain, even when they just did it after 12 weeks. So, which exercises? So, you would like to know that any walking, long distance running, jogging, swimming, dancing, gardening, all of these are aerobic exercises. Your gains will begin within a few months, but it'll be lost if you are inactive. So your physical exercise should be sustained and consistent. So the second cornerstone of how you can reverse the aging effects on the brain is cognitive engagement. Now, the brain reserve refers to a larger brain and larger hippocampus. Intellectually stimulating exercises actually increase the size of this. This is brain reserve. And the bigger the brain reserve, you have more tolerance to pathology. If any pathology were to come, the bigger brains are able to overcome that challenge. Cognitive reserve refers to your ability to redeploy or retrain existing nerve pathways, or use what we call in our Punjab jugaad, variability of approach to problem solving. I like to explain this in a particular way. For example, you have to go from point A to C, and you're going A, B, C. Something happens in the region of B, and there is an aging, cognitive loss, or whatever it is. But you are not able to get to the point C because you cannot go through B. So, cognitive reserve means that you're going to retrain to go ABC, ABC, ABC. So, you're retraining and redeploying your existing pathways which you used when you were young. And ultimately, you awaken it and you go to C. That is this redeploy. When it comes to jugaad, okay, you tried and you find that you're not able to go to B at all. So how will you reach C? So you go to E. You go to E, D, C. So you have found an alternative pathway to reach C. And you keep doing that and you actually create the channels to reach your target. So this is known as using variability of approach to problem solving. And when you do this, then of course the thresholds at which impairment is to occur is raised. So continuing to do cognitively demanding activities prevents the age related decline. So you retire and you pick newspaper and the only thing you do is you read that. That is not cognitively demanding. So definitely there will be an age. So yeah, by mistake, I think the host muted me. Yeah, I've managed that now. So what I'm saying is that if you're in enriched environments which are very challenging, so for example, every time you go to work, you take a different route. Take a new route to work and don't use Google Maps. All your challenging activities that you choose, they should not be very difficult for the elderly, and they should be appropriate. Appropriate means you have an aging parent who was, say, a financial stock consultant, and you tell him, Papa, do these stocks again. So for him, it is not challenging. So stocks may be challenging for another person, but not for him. So for him, you can tell him, Papa, can you learn a new instrument? So that would be challenging. So cognitive engagement to be of value should be sustained, engaging, and enjoyable. So I have listed for you, this looks like a busy slide, but it is a very lovely slide. You look at it because these are examples which you can choose for yourself and for your patients and your parents and family. What are the cognitively demanding activities? These are of three types: occupational, leisure, and social. Occupational does not mean profession related. It is not always work related. It can be non-professional related. Mild degree of stress is stimulating, but too much of stress causes limitation of the brain functions. A high literacy and complexity of the profession is actually a proxy for prevention of cognitive decline, even in those people who have a genetic tendency to cognitive decline as they age, like the apoprotein E4 carriers. versus the unskilled population. These things are very important, so I list it for you. All these things improve cognition, no employment gaps, set routines. When you have a set routine, you get up at this time, eat at this time, sleep at this time, walk at this time, your physiological functions improve and your brain is part of that physiology. So new training, what they have mentioned in literature is learning digital photography, quilt making, the fine use of your hands, fine skills, new skills like juggling of 3 balls, golf, and singing. Now, you could actually learn how to sing and play golf, but the crucial part here is doing it well. The doing it well, that effort, that is important. So, playing new instruments like the piano has been found in literature to be far better than yoga, dancing, and juggling, and learning a new language, not just speaking it, but learning it well. So then you have leisure activities, and there are many of them like card and board games. When I was in Canada, we used to, it was very well known that the card game, board game, Ticket to Ride, played by families, it was very popular. And but all of these, like puzzles like Sudoku and all these, they're not as good as your new hobbies and your occupational, this list. The social part is very, very important. Theater, concerts, socializing, because the more number of people you meet, the more you travel, more improves what? This is called a social cognition, because every time you meet a person, you have to remember what that person's name is, where did you meet him last, what was your last conversation, what job does he do, what is he saying just now, what would be my most appropriate response just now. So you see, you're integrating so much of information, and social cognition has been recognized as a very powerful tool for neuroplasticity. And then, of course, I mentioned mindfulness meditation, because a lot of work has been done on this. Our presentation today is not on details on this. I can just say that in very simple words, it means be here now. So if your right hand is moving like this, you're aware of this. If your left hand is doing this, you're aware of what your left hand is doing, and you can use various techniques, breath, mantra, yantra, to get there. So you, this is another very powerful tool. Now, few principles of experience dependent plasticity is that, see, the brain is not an it is not a tissue. So it's the whole thing is a process. So the more you exercise it, the more it'll work, it'll get enhanced. Repetition matters. You keep hammering at it, and then you can create those new pathways. Intensity matters. So you juggle 600 times in a day, or you juggle 50 times in a day, it'll make a difference to how your synapses are created. Now, these rest of them have not, they have been used more for neurodegenerative issues. So I'm not touching them. But for age related, it was basically these four. So the third cornerstone of neuroplasticity is diet. We all know that the brain uses a lot of energy. It needs that energy to maintain the concentration across and the gradients across membranes and for the synaptic activity. And we have now a lot of bioactive substances in food which help in improving cognition. These are all much better than taking drugs. You take drugs with spice extract, cocoa extract. No, the food is much better to take. And I've listed for you those foods which have actually been found to have a direct correlation with cognition. And with your permission, I would actually like to read them, like clove, star anise, peppermint, berries, blue, black, strawberries, raspberries, chocolates, cocos, the teas. The black oolong is a Chinese tea, and green tea, they have a dose dependent effect. But too much of everything is not good also. So all the red wines and the beans and all the red colored fruits currants, cherries, apples, the peas, pomegranate, plums, papayas, nuts shaped in the form of a brain, the walnuts, pecans, hazelnuts, almonds, red onions, spinach, and the red cabbage, and the red lettuce, all soya products. Curcumin is actually a curcuminoid. We find that uh, we need about 1000 milligrams per day. You have to add a little bit of black pepper extract and take it with a fatty meal. Just taking curcumin alone is not enough. So, this is the combination where it will get absorbed. Now, we are Indians and we are so proud of the fact that all our diets contain turmeric. But just look at what we found was that Indian diets, uh, only 3% of it is curcumin, and the extract is 95%. So if your requirement is 1000 and your Indian diet, you're taking 2.5 grams of turmeric in a day, you're barely taking 60 milligrams of curcumin per day. So it's better to take it in the form of extracts. Resveratrol, these grapes are the ones from which they make wine. So the red grapes. So all of these. And omega-3 fatty acids, the requirement is 1.1 gram per day. And these are the sources of omega-3 fatty acids. Remember that unsaturated fatty acids, polyunsaturated is what we want. And hydrogenated and saturated is what we don't want. So I actually went through the actual amounts. How much does the fatty fish contain? The sardines, mackerel, herring. And these are the things for your benefit. I've actually laid down how much you require to get your omega-3 in a day. 25 grams of fatty fish, 3 walnuts, 1 teaspoon of seeds, and half teaspoon of these various oils. So this cannot be complete until I touch upon diet plans, because these have been found to have great effect on neuroplasticity. One of them is the daily calories restriction. In some studies, when they decreased it by 30%, the verbal memory improved by 20%. The other one is intermittent fasting. Daily calorie restriction, I need to tell you, is not sustainable for very long. And I would encourage all of you to go through our official Indian Menopause Society YouTube channel, which is called Digital Education Indian Menopause Society, where you will get details about intermittent fasting and daily calorie restriction. But very briefly, this is very good. You can do alternate day fasts where you take 0 calories on the day of the fast, modified alternate day fast where you take 500 kilocalories on the day you fast, and time restricted feeding where you are taking no food from 6 p.m. to 10 a.m., or even you take 2 meal a day or a 1 meal a day. So intermittent fasting actually has found that not only is it neurogenetic, but it is synaptogenetic, improves signaling, and it decreases inflammation and all the markers of oxidative and metabolic stress. So finally, we come to the take-home messages. Age-related cognition decline may be mild in most, but some people have a real impairment in daily activities. But all benefit from these three cornerstones of neuroplasticity, which is physical activity, cognitive engagement to challenge yourself, changing your diet by improving those which are bioactive, and intermittent fasting, and doing mindfulness meditation. Change is constant. Even the age related cognitive decline is a change. So don't fight it, but work with it. You can delay, prevent, reverse, improve. Age related cognitive decline. Some people may require additional cognitive training. Whatever you are doing, that training, it may improve to improvement of some faculty that you are training for, but it may not lead to a broad improvement in all mental faculties. So near and far gains, no. this idea actually in the media and in advertisements is most of these brain training programs, all these ideas come from there and they are market driven and they are not true. So thank you all. Thank you.
Thank you.
Thank you. Thank you very much, Dr. Nirja. It was a wonderful presentation, I will say. It was a very difficult subject, a new subject to this crowd, but you explained it in a very simplified way. What I understood is that, shall I say something, some experts from your lecture?
Yes,
Yeah.
please.
One is, I've written it, neuroplasticity. It is referring to a lifelong capacity of the brain to change and rewire itself in response to the stimulation of learning and experience. Then second important thing was neuroimaging and other modalities of diagnosing it. It has played a very important role in understanding neuroplasticity. Third thing was very important, what we are teaching it in our holistic approach of menopause, that combining physical activity with sensory enrichment has stronger and longer lasting effects on the brain rather than giving by only medicines. And one more thing I understood is that new neurons can be generated at any age, and diet has a very important role to play. So, friends, new motor and other skills can be acquired at any age. After the age of 40, 60, or even 80, even though the progress may be somewhat attenuated in older compared to younger population. But the important message is at any age you can go for the development of brain to understand, to learn the new things. And this is a big message by Dr. Nirja to all the midlife women, not only women, but to all the aging men also. So thank you very much.